Hello viewers, today I want to talk about healthcare wait times, specifically my own experience in the Canadian medical system. First of all, I want to break through a myth in medical care when looking at it from a system perspective. Better health outcomes do not come from necessarily being able to purchase the fastest procedure possible. For example, I know that on average, we probably wait longer in Canada versus the US for most elective procedures. Not emergency, but like elective procedures. But the reason for that is because everyone has open and free access. The problem is, in the US typically, is that lots of people in the population can't even afford to go to the doctor. Their accessibility is suppressed. There's no official tracking of this type of data, so other people who have enough insurance and money can generally get that procedure faster. However, again, there's no real way of tracking this. There's no scientific surveys because even the surveys that do exist, they're not able to even hit 1% of the doctor's offices in the US to survey it, or hospitals. Same's true for Canada, to find out what's happening in a given time frame. We do have better data in Canada because hospitals generally report wait times from initial scheduling to the procedure, and that information gets centralized, but it's not representative of every case. So, without further ado, I'll give you my personal story. Back in December 2018, I went to my family doctor. I explained I was having difficulty breathing at night, and my tonsils were regularly swelled, severely, especially when I had colds or other infections that people regularly get. He referred me to an ENT, an ear, nose, throat specialist. By early February, so we're talking about, I can't remember the time in December, but it was before Christmas. So from early December, it took me early February when I saw the ENT specialist. And that specialist determined I was a good candidate to have my tonsils removed to relieve the sleep apnea and other symptoms. They scheduled me for surgery in May, which was a 3-month wait from when I saw the specialist in February. But someone canceled their surgery, luckily for me, and I was able to get it the same month. And I had, like, the next week, in February 2019, I got my surgery. So that was my personal experience. I received quality care. The surgery went off without any problems. The doctor care was terrific. They were very professional, and I was satisfied with the result. Now I sleep better. I don't have my tonsil problems anymore. Feels great. So let's look at the wait times in the Canadian system. I went to my doctor in December. I had an initial specialist visit, or the referral visit, early February. I got scheduled for surgery. It was available in May. This was in St. Mike's Hospital in downtown Toronto. They scheduled me for May, but they had somebody cancel, so they bumped me up to the same month due to a cancellation. So I really only waited 2 months, 2.5 months. My question to you is, do you think 5 months is a long time to go from mentioning a problem with your family doctor, seeing a specialist, and getting a scheduled surgery? Now, I lucked out and effectively had a 2.5-month wait, but I'm aware that was a luck of the draw situation. The point remains, though, I had very high quality of care. Since we don't really have reliable scientific wait time data for the US, I can tell you when I lived in the US, I had procedures performed in the US that weren't as serious as tonsil removal, and I waited 3 months from my original family doctor visit to the specialist visit to the actual procedure. It was a 3-month time frame. Honestly, it didn't seem like that much of a difference to me. Even if I had to have waited to May, which was a 5-month window from the original family doc visit to the specialist to the operation, I wouldn't have minded that wait. Why? Because it's fully covered at no extra out-of-pocket cost. And I still got good care at the end of the day here in Canada. So what I'm saying is, I don't think wait times are unacceptable here in Canada. I had a good experience, and that's my wait time experience in the Canadian health system. Thank you for watching.